so much misinformation in one single comment. But since these are things that I see almost every day in my comment section, obviously it needs addressing. So let's hit them one by one. There is nothing magical about cord blood. The blood that remains in the umbilical cord after the birthing process is the exact same blood that is in the rest of baby's body. It's constantly circulating, baby, cord, placenta, and back. So while there are noted benefits from delayed cord clamping when appropriate that can increase that number of resources to baby a small amount, there's nothing extra magical about blood that's in the umbilical cord that's not already circulating in baby's bloodstream. In reference to those stem cells healing birthing damage or trauma, it does not fix a brain bleed. Yes, stem cells can help regenerate tissue, cells at a cellular level, but they don't fix brain that has been destroyed from blood pouring out of blood vessels that have ruptured and displacing the volume of the brain where it should be. That's what vitamin K does. See, vitamin K helps produce clotting factors. The clots will stop small bleeds before they become big bleeds and prevent brain bleeds. Which leads us to misinformation number 2 in this comment. Once again, attributing divine or magical properties to colostrum versus mature milk is just not accurate. They're both low in vitamin K. In fact, we can see that when we measure colostrum versus mature milk, there's not a big significant difference in vitamin K quantity. Further, we read that vitamin K in breast milk is oftentimes insufficient to meet infants' needs. It's poorly transmitted through the placenta, and it's poorly transmitted through breast milk. Finally, and maybe most importantly, that people just don't realize is that babies aren't born perfect. If God made everything perfect and babies were perfect before modern medicine, what was Jesus healing? Why did 50% of babies die before the age of 2? Why has childhood mortality suddenly decreased from near 50% to less than 0.2%? God didn't make babies perfect, but He did give us medicine so that we can save their lives, including giving vitamin K at birth to decrease rates of bleeding that could happen in 1 to 2% of newborns. Finally, you have no idea what type of informed consent I perform with my patients. In fact, most of the time, I'm not even there when vitamin K is administered because I'm not at the delivery. But I do have to take care of the babies of the people that refuse vitamin K and have taken care of very many patients with horrible brain bleeds from vitamin K refusal. So just take your vitamin and don't bleed.